Welcome to our video on vagus nerve. What is an vagus nerve? What is its role in our body? Vagus nerve, also known as the 10th cranial nerve X, or simply CNX, is a cranial nerve that carries sensory fibers that create a pathway that interfaces with the parasympathetic control of the heart, lungs, and digestive tract. It comprises two nerves, the left and right vagus nerves, but they are typically referred to collectively as a single subsystem. The vagus is the longest nerve of the autonomic nervous system in the human body and comprises both sensory and motor fibers. The sensory fibers originate from neurons of the nodosal ganglion, whereas the motor fibers come from neurons of the dorsal motor nucleus of the vagus and the nucleus ambigus. The vagus was also historically called the pneumogastric nerve. Structure of vagus nerve. Upon leaving the medulla oblongata between the olive and the inferior cerebellar peduncle, the vagus nerve extends through the jugular foramen, then passes into the carotid sheath between the internal carotid artery and the internal jugular vein down to the neck, chest, and abdomen, where it contributes to the innervation of the viscera, reaching all the way to the colon. Besides giving some output to various organs, the vagus nerve comprises between 80% and 90% of afferent nerves, mostly conveying sensory information about the state of the body's organs to the central nervous system. The right and left vagus nerves descend from the cranial vault through the jugular foramina, penetrating the carotid sheath between the internal and external carotid arteries, then passing posterolateral to the common carotid artery. The cell bodies of visceral afferent fibers of the vagus nerve are located bilaterally in the inferior ganglion of the vagus nerve, nodosal ganglia. The vagus runs parallel to the common carotid artery and internal jugular vein inside the carotid sheath. The right vagus nerve gives rise to the right recurrent laryngeal nerve, which hooks around the right subclavian artery and ascends into the neck between the trachea and esophagus. The right vagus then crosses anterior to the right subclavian artery, runs posterior to the superior vena cava, descends posterior to the right main bronchus, and contributes to cardiac, pulmonary, and esophageal plexuses. It forms the posterior vagal trunk at the lower part of the esophagus and enters the diaphragm through the esophageal hiatus. The left vagus nerve enters the thorax between left common carotid artery and left subclavian artery and descends on the aortic arch. It gives rise to the left recurrent laryngeal nerve, which hooks around the aortic arch to the left of the ligamentum arteriosum and ascends between the trachea and esophagus. The left vagus further gives off thoracic cardiac branches, breaks up into the pulmonary plexus, continues into the esophageal plexus, and enters the abdomen as the anterior vagal trunk in the esophageal hiatus of the diaphragm. Branches of vagus nerve are pharyngeal nerve, superior laryngeal nerve, aortic nerve, superior cervical cardiac branches of vagus nerve, inferior cervical cardiac branch, recurrent laryngeal nerve, thoracic cardiac branches, branches to the pulmonary plexus, branches to the esophageal plexus, anterior vagal trunk, posterior vagal trunk, Herring-Brewer reflex in alveoli. Nuclei of vagus nerve are. The vagus nerve includes axons which emerge from or converge onto four nuclei of the medulla. The dorsal nucleus of vagus nerve, which sends parasympathetic output to the viscera, especially the intestines. The nucleus ambigus, which gives rise to the branchial efferent motor fibers of the vagus nerve and preganglionic parasympathetic neurons that innervate the heart. The solitary nucleus, which receives afferent taste information and primary afferents from visceral organs. The spinal trigeminal nucleus, which receives information about deep, crude touch, pain, and temperature of the outer ear, the dura of the posterior cranial fossa and the mucosa of the larynx. Development. The motor division of the glossopharyngeal nerve is derived from the basal plate of the embryonic medulla oblongata, while the sensory division originates from the cranial neural crest. Function of vagus nerve. The vagus nerve supplies motor parasympathetic fibers to all the organs, except the adrenal glands, from the neck down to the second segment of the transverse colon. The vagus also controls a few skeletal muscles, including cricothyroid muscle, muscle of larynx. Its action tilts the thyroid forward to help tense the vocal cords. Levator veli palatini muscle, muscle of the soft palate and pharynx. During swallowing, it contracts, elevating the soft palate to help prevent food from entering the nasopharynx. Salpingopharyngeus muscle, muscle of the pharynx and lower part of the cartilage of the eustachian tube. It opens the pharyngeal orifice of the eustachian tube during swallowing to allow for the equalization of pressure between it and the pharynx. Palatoglossus muscle of the soft palate and an extrinsic muscle of the tongue. Its surface is covered by oral mucosa and forms the visible palatoglossal arch. It closes the oropharyngeal isthmus, and aids initiation of swallowing. This muscle also prevents the spill of saliva from vestibule into the oropharynx by maintaining the palatoglossal arch. Palatopharyngeus muscle, small muscle in the roof of the mouth. By their contraction, pull the pharynx upward over the bolus of food and nearly come together, the uvula filling up the slight interval between them. By these means the bolus is prevented from passing into the nasopharynx, at the same time. Superior, middle and inferior pharyngeal constrictors, a group of muscles that form the pharynx affecting its sound properties as the primary resonating cavity. The pharyngeal muscles, involuntary skeletal, push food into the esophagus. Muscles of the larynx, speech. This means that the vagus nerve is responsible for such varied tasks as heart rate, gastrointestinal peristalsis, sweating, and quite a few muscle movements in the mouth, including speech, via the recurrent laryngeal nerve. It also has some afferent fibers that innervate the inner, canal, portion of the outer ear, via the auricular branch, also known as Arnold's or Alderman's nerve, and part of the meninges. Efferent vagus nerve fibers innervating the pharynx and back of the throat are responsible for the gag reflex. In addition, 5-HT3 receptor-mediated afferent vagus stimulation in the gut due to gastroenteritis is a cause of vomiting. Stimulation of the vagus nerve in the cervix uteri, as in some medical procedures, can lead to a vasovagal, reflex syncope, response. The vagus nerve also plays a role in satiation following food consumption. Knocking out vagal nerve receptors has been shown to cause hyperphagia, greatly increased food intake. Vagus nerve in the hepatic nerves and lipid metabolism. Increased lipid level in the portal vein stimulates afferent fiber of the hepatic vagal nerves, suppressing the intake of food. Leptin secreted by adipocytes activates hepatic sympathetic nerves via the central nervous system, CNS, decreasing the triglyceride, TG, content in the liver. Cardiac effects of vagus nerve. Parasympathetic innervation of the heart is partially controlled by the vagus nerve and is shared by the thoracic ganglia. Vagal and spinal ganglionic nerves mediate the lowering of the heart rate. The right vagus branch innervates the sinoatrial node. In healthy people, parasympathetic tone from these sources is well matched to sympathetic tone. Hyperstimulation of parasympathetic influence promotes bradyarrhythmias, slow resting heart rate. When hyperstimulated, the left vagal branch predisposes the heart to conduction block, disorder in the heart's rhythm due to a fault in the natural pacemaker. This is caused by an obstruction, a block, in the electrical conduction system of the heart. Sometimes a disorder can be inherited. At the atrioventricular node. Excessive activation of the vagal nerve during emotional stress, which is a parasympathetic overcompensation for a strong sympathetic nervous system response associated with stress, can also cause vasovagal syncope due to a sudden drop in cardiac output, causing cerebral hypoperfusion. Vasovagal syncope affects young children and women more than other groups. It can also lead to temporary loss of bladder control under moments of extreme fear. Research has shown that women having had complete spinal cord injury can experience orgasms through the vagus nerve, which can go from the uterus and cervix to the brain. Insulin signaling activates the adenosine triphosphate, ATP, sensitive potassium, KATP, channels in the arcuate nucleus of hypothalamus, decreases AGRP, a GUT-related protein appetite stimulator, release, and through the vagus nerve, leads to decreased glucose production by the liver by decreasing gluconeogenic enzymes, phosphoenolpyruvate carboxykinase, glucose 6-phosphatase. Functions of vagus nerve. The sympathetic and parasympathetic components of the autonomic nervous system, ANS, control and regulate the function of various organs, glands, and involuntary muscles throughout the body, e.g., vocalization, swallowing, heart rate, respiration, gastric secretion, and intestinal motility. Sympathetic and parasympathetic divisions typically function in opposition to each other. But this opposition is better termed complementary in nature rather than antagonistic. For an analogy, one may think of the sympathetic division as the accelerator and the parasympathetic division as the brake. The sympathetic division typically functions in actions requiring quick responses. The parasympathetic division functions with actions that do not require immediate reaction. The sympathetic system is often considered the fight or flight system, while the parasympathetic system is often considered the rest and digest, or feed and breed, system. In general, these two systems should be seen as permanently modulating vital functions, in a usually antagonistic fashion, to achieve homeostasis. Higher organisms maintain their integrity via homeostasis, which relies on negative feedback regulation, which, in turn, typically depends on the autonomic nervous system. A fight or flight response corresponds with arousal and energy generation, and inhibits digestion. Diverts blood flow away from the gastrointestinal, GI, tract and skin via vasoconstriction. Blood flow to skeletal muscles and the lungs is enhanced, by as much as 1200% in the case of skeletal muscles. Dilates bronchioles of the lung through circulating epinephrine, which allows for greater alveolar oxygen exchange. Increases heart rate and the contractility of cardiac cells, myocytes, thereby providing a mechanism for enhanced blood flow to skeletal muscles. Dilates pupils and relaxes the ciliary muscle to the lens, allowing more light to enter the eye and enhances far vision. Provides vasodilation for the coronary vessels of the heart. Constricts all the intestinal sphincters and the urinary sphincter. Inhibits peristalsis. Stimulates orgasm. The pattern of innervation of the sweat gland, namely, the postganglionic sympathetic nerve fibers, allows clinicians and researchers to use pseudomotor function testing to assess dysfunction of the autonomic nervous systems, through electrochemical skin conductance. The parasympathetic nervous system has been said to promote a rest and digest response, promotes calming of the nerves, return to regular function, and enhancing digestion. Functions of nerves within the parasympathetic nervous system include dilating blood vessels leading to the GI tract, increasing the blood flow. Constricting the bronchiolar diameter when the need for oxygen has diminished. Dedicated cardiac branches of the vagus and thoracic spinal accessory nerves impart parasympathetic control of the heart, myocardium. Constriction of the pupil and contraction of the ciliary muscles, facilitating accommodation and allowing for closer vision. Stimulating salivary gland secretion, and accelerates peristalsis, mediating digestion of food and, indirectly, the absorption of nutrients. Sexual orgasm. Nerves of the peripheral nervous system are involved in the erection of genital tissues via the pelvic splanchnic nerves 2 to 4. They are also responsible for stimulating sexual arousal. Enteric nervous system is the intrinsic nervous system of the gastrointestinal system. It has been described as the second brain of the human body. Its functions include sensing chemical and mechanical changes in the gut, regulating secretions in the gut, controlling peristalsis and some other movements. Vagus nerve pathology. Hence, most of the signs and symptoms of vagus nerve dysfunction, apart from vocalization, are vague and nonspecific. Laryngeal nerve palsy result in paralysis of an ipsilateral vocal cord and is used as a pointer to diseases affecting the vagus nerve from its origin down to termination of its branch of the laryngeal nerve. Epilepsy, supraventricular tachycardia, atrial fibrillation. Vagus normally stimulates the stomach's parietal cells to secrete acid and intrinsic factor. Intrinsic factor is needed to absorb vitamin B12 from food. But defect in vagus activity affects intrinsic factor secretion and ultimately leads to vitamin B12 deficiency, which, if left untreated, causes nerve damage, tiredness, dementia, paranoia, and ultimately death. The development of Parkinson's disease, suggesting that Parkinson's disease begins in the gastrointestinal tract and spreads via the vagus nerve to the brain. The hypersensitivity of vagal afferent nerves causes refractory or idiopathic cough. Rheumatoid arthritis, inflammatory bowel disease, bipolar disorder, obesity and Alzheimer's disease, headaches and migraine. Aortic aneurysm is a bulge in the wall of your aorta, the main artery from your heart. Aortic aneurysms form in a weak area in your artery wall. They may rupture, burst, or split, dissect, which can cause life-threatening internal bleeding or block the flow of blood from your heart to various organs. Aneurysmal wall of right extracranial internal carotid artery prevented occurring persisting damage of the adhesive vagus nerve. Treatment involves vagus nerve stimulation, VNS, refers to any technique that stimulates the vagus nerve, including manual or electrical stimulation. Left cervical VNS is an approved therapy for refractory epilepsy and for treatment-resistant depression. Drugs like choline, acetylcholine, AKE inhibitors like pyridostigmine, donepezil, nucleoside like adenosine, statins like simvastatin, beta-blockers like atorvastatin, carvedilol, metoprolol, ACEIs like ramipril, enalapril, delapril. Nutrients that support the vagus nerve include choline, to make acetylcholine, our main neurotransmitter. vitamin B12, magnesium, calcium, sodium, salt, omega-3 fats. Singing, humming, chanting and gargling can activate these muscles and stimulate your vagus nerve. Breathing exercises are often recommended when it comes to stress and anxiety. Massage, cold water immersion. Laugh, connect with others. Autonomous sensory meridian response. Etymology. The Latin word vagus means literally, wandering. The words vagrant, vagabond, vague, and divagation come from the same root. Sometimes the right and left branches together are spoken of in the plural and are thus called vagi. The vagus was also historically called the pneumogastric nerve since it innervates both the lungs and the stomach.